Hi, this is Chad Clark, Physical Therapy Connections, and doing another video on a popularly asked question on if I have SI joint. So this area is if you have pain, pretty much, SI stands for sacrum and ilium bones. When they come together, it's basically right in this area where people will almost pinpoint and go, you know, it's like right below the belt line, right here, or they have it on the other side, or both. A quick test that was mentioned in the lumbar video that you could check out, but what you would do is you'd lay down on your stomach and you might have pain just by doing that position. Then if you prop up on your elbows and or prop up on your hands, if that intensifies the pain, especially on one side where your SI joint, it's more than likely you have an SI joint pain or dysfunction and not just general low back pain. So there is a key difference with that. One simple thing you can do to yourself, obviously there's a lot of things we can help you with that, but I always want to show people what they can do on themselves until that doesn't work, is let's say you do this movement and you feel the pain on your left side. What you can do, and I'll show this in various levels of intensity because some people will be able to do this, some will not, is if it's on your left side, and just for the purpose of this video, you want to make sure you're secure on this. So if you get on a step, you can do it on the floor, but it's a little tough because you want to have some vertical space there. So the pain's on the left, you kind of let your left leg hang, and you can do a little bouncing because you're trying to traction this area. If it's not really caught up or snagged, that may work. You could also just do more of a prolonged kind of stretch. Again, you got to really make sure your balance is good, and I know this is a high level thing, but you can let it and almost let it hang, almost use your other hand to push down, and you should find some relief with that. Again, you might have to hold on to something for balance, but you're pushing and just letting gravity hang. You could add some swings to it or circles, but the main point is you're getting gravity to help traction. Then to make sure that worked, you'd go back and check and see, did that make a difference? And it should alleviate some pain. Another thing, without getting too confusing on this, again, if it's back on this left side, you can play around with, again, you want to hold on for support, where you can stretch the opposite side hip flexor because you're adding some extension, which might be too much for that left side, and see if that helps. You could also do the same thing on the left. As long as it doesn't pinch that SI joint too much, what you're doing is you're stretching out the front hip flexor. We find that when you add movement to the stretch, meaning you move into the stretch, you come out of it. You move in, you come out. There's nothing wrong with holding it there, but sometimes when people hold, it may intensify that pain in your SI joint, and you simply want to do more movement to mobilize and get some blood flow into that area. And then, of course, always recheck. So those are a couple quick hitters. I know there's much, much more, but for the short videos, and then you could also check out our video library if you'd like more based on these topics. Those are some things that can help you out. And like always, please let us know your comments, or maybe you have some special things that you found that work well that you could share, and that always helps other people. So thank you very much.